Hello everyone, my name is Matthew, and today I'll be presenting a drug education video about methotrexate, a powerful medication that is used to treat cancer. To understand why methotrexate is so important, let's talk about cancer itself. Cancer is characterized by the uncontrolled growth of abnormal cells. Normally, cells would grow and divide in a controlled way, but in cancer, it starts to divide uncontrollably. Tumors are a mass of abnormal cells that can be split into two categories. The first one being benign tumors, which are non-cancerous tumors that do not spread, whereas malignant tumors are cancerous tumors that can spread to other parts of your body. Now, scientists have discovered several key traits or hallmarks of cancer that make cancer cells different from normal cells, and this provides a framework for how scientists think about treating cancer. And the theory is to target these specific traits to stop cancer cells from growing, dividing, and spreading. And one drug that does just this is methotrexate. Methotrexate was developed to interrupt one of the most critical hallmarks of cancer, uncontrolled cell division. And this leads us to the history and story of methotrexate's discovery. Methotrexate's story begins in the 1940s with a doctor named Dr. Sidney Farber, who was trying to find a cancer treatment for leukemia, a type of blood cancer at that time. He knew that a nutrient called folic acid, a form of vitamin B, was essential for cell growth. But instead of adding folic acid to help cells, Dr. Farber wondered, what if we block it? Could this stop cancer cells from growing? Working with the chemist Prada Saboro in 1947, they developed aminopterin, the first anti-folic drug. Aminopterin worked by blocking folic acid and halting cell division, and this actually stopped cancer cells from growing. And then later, in 1948, methotrexate was then synthesized based on aminopterin's formula, and it became widely used in the 1950s to treat cancer. So, how does methotrexate actually work? Well, in order for a cell to grow and undergo cell division, it needs its DNA to be replicated. And this requires the building blocks of DNA called nucleotides. Methotrexate simply inhibits the cell's ability to make certain nucleotides or building blocks, which prevents DNA replication and cell division. And you may be wondering, how does it stop the production of nucleotides? Well, we need to look inside the cell. Inside the cell, there is folate, or vitamin B9, and it needs an enzyme called dihydrofolate reductase to turn it into its active form in order to make the building blocks of DNA. And what methotrexate does is it inhibits this enzyme and stops the conversion of folate into its active form from preventing the synthesis of nucleotides. And without the building blocks of DNA, the cell cannot replicate its DNA and undergo cell division. Alright, now what is methotrexate's intended job? Well, it's intended to slow down or stop cell growth, and this means it can help reduce the spread of cancer cells and also calm an overactive immune system response in autoimmune diseases. However, methotrexate cannot determine the difference between cancer cells and normal cells, and this can cause side effects. The common ones include nausea, vomiting, mouth sores, and a loss of appetite. But for most of these symptoms are manageable. But methotrexate can also cause more serious side effects like liver toxicity, especially with long-term use. So it is really important to be under medical supervision when using this drug. And with that in mind, methotrexate is indicated for patients with leukemia, breast cancer, and lung cancer, and also for some autoimmune diseases where your body's immune system attacks itself, such as rheumatoid arthritis and psoriasis, a skin condition. Methotrexate is also not used recreationally because of its intense side effects. Now, methotrexate isn't for everyone. There are important contraindications or times when this drug should not be used, and this includes if someone has kidney or liver disease, where methotrexate can accumulate in the body as the drug is metabolized by the liver and excreted through the kidneys. Also, pregnant women should not use methotrexate as it is known to cause birth defects which could affect the baby's health. And finally, people with blood disorders like anemia should not take it as it could affect the blood cell production. Methotrexate could also have some serious drug interactions with some antibiotics, non-steroidal anti-inflammatory drugs, folic acid supplements and proton pump inhibitors such as omeprazole. These could either increase methotrexate levels in the body or reduce its effectiveness. And to wrap it up, there are some off-label uses with methotrexate in treating atopic dermatitis, which is a type of eczema, where this treatment has not received regulatory approval from Health Canada, but could be an effective treatment. Thank you very much. Have a nice day.